Hello, everyone, and welcome to the first of Scholarship Live session. My name is Anna Garnett. I'm an assistant professor here in the School of Nursing, and I'm going to be moderating the session today. So today, during this session, this virtual speaker series was initiated to share and promote nursing research and scholarship within the Arthur Labatt Family School of Nursing and across the broader nursing community. So the goal of these sessions is that our speakers will profile innovative research being conducted across academic and community settings and address how their work can inform transformative changes in practice, education, and or potentially within policy. So our speakers will present for about 30 minutes, and then we'll have a period of time for some questions. Because we're using a webinar format, you will not be able to unmute and ask questions. So we encourage you to add questions or comments in the question and answer function so that our speaker can address them at the end of her talk. Just so you know, today's session will also be recorded. So first of all, I'm going to give a land acknowledgement. So we acknowledge the Anishinaabe, Haudenosaunee, Liapain-Wook, Shunacontun nations whose traditional lands we are gathered upon today and that we learn upon at Western University. So today's Scholarship Live speaker is Dr. Susana Caxaj. Susana is an assistant professor in the School of Nursing, as well as the co-founder and core member of the Migrant Worker Health Expert Working Group and the co-chair of the Decolonization, Anti-Racism, and Anti-Oppression School of Nursing Committee, otherwise known as DARO. Her research is focused on exploring underserved populations' access and navigation of health and multi-sectoral services with a particular focus on racialized, migrant, and Indigenous populations. Today, she'll be presenting her work on the rights to health, quality housing, and legal protection available on paper, but not necessarily applied in practice to temporary migrant farm workers. With that, I'll turn it over to you, Susana.
Thank you so much, Anna, and thank you for the opportunity to share. My apologies in advance. I think whenever I started planning this presentation, I was a little ambitious. So you'll get a bit of a whirlwind into a few of the different projects that I have going on today. So a little bit of background about migrant agricultural workers that will be my focus today. Migrant agricultural workers typically come under two programs, the Seasonal Agricultural Worker Program, of which pilots existed as early as the 1960s in Ontario, in newer iterations since the 2000s, such as the Temporary Foreign Worker Program agricultural stream. These programs tend to range from 8 months to 2 years, but they're characterized by what we call circular migration. And by circular migration, we mean programs that we would expect workers to return year after year, which kind of raises the question of, are these individuals truly temporary, or are they simply living on the margins of Canadian society? Migrant agricultural workers make up about 1 in 5 of the agricultural sector. And during the COVID-19 pandemic, you may recall some of the exemptions that were made for migrant workers to return to Canada to work in agriculture. So they're key to our food system. They're key to the agricultural industry. And I'm so sorry, this is quite unprofessional, but I've just realized that my computer is almost out of charge. So just give me 1 second to do that. Wonderful. Okay, so the 3 studies that I would like to talk to you about today really span from about 2019 to present day. The first study looks at service seeking and barriers for migrant agricultural workers, especially in the British Columbia context. And here I'll talk to you about 2 cross-sectional surveys with hundreds of workers. I also want to talk to you about a study that we conducted to look at the deaths of migrant agricultural workers in Ontario during the COVID-19 context. This was a partnership with the the Deputy Chief Coroner of Ontario, where we were able to analyze some of the underlying factors related to deaths in Ontario among migrant agricultural workers. And lastly, a study that's ongoing that we call MIHA, Migrants Intersecting Experiences with Housing and Agriculture, which is a narrative analysis that so far has enrolled about 50 participants focused on living conditions and housing experiences of this population. So first, let's take a look at some of the cross-sectional data that we have coming out of BC. But you will, I won't have a lot of time to necessarily unpack this too much, but you'll see, I'll refer you to kind of the publications where this work is coming from, that there is some previous research in Ontario that likewise mirrors some of this data. So a note about how these surveys were carried out, although we used kind of Likert responses, 5-point Likert scale responses, the surveys were collected kind of verbally by a bicultural Spanish speaking research assistant, just because of the level of trust and barriers that this group might face in kind of carrying out surveys. So just give you a bit of a behind the scenes look at that. So what were some of the kind of key things that we found? So the data that I'm presenting to you today represents two separate cross-sectional surveys. I visually put them together in a graph so that you can see either the level of kind of consistency across both seasons with two different samples of over 140 or 170 participants. And you can also see what may suggest increases in certain issues faced by this population. So the darker line represents 2019 data, and the lighter blue represents 2020 data. So you can see that over 1 in 5 migrant agricultural workers reported being threatened or intimidated by employer. 14 or 15% report being assaulted by an employer in the 2019 and 2020 season. This group, agricultural generally, is a very hazardous occupation, and this group kind of mirrors what we know about agriculture, and that many individuals have been injured in the past few years. So these last two graph points here speak to questions that we ask migrant agricultural workers around discrimination. So the first time around, we just asked generally about what would be considered human rights protection identities, and we didn't tease out race from gender or nationality. The second time around, we asked specifically about race or nationality because of the kind of qualitative accounts that we were given. And you can see that close to 40% of migrant agricultural workers feel discriminated on the basis of race or nationality. Beyond kind of these kind of broader, well, maybe not broader contextual issue, but kind of things that might fall under kind of human rights issues and discrimination, we also wanted to get at questions that had to do with care and service navigation. So our 2020 data showed that close to half of migrant agricultural workers wouldn't know how to get help with serious issue. So sometimes these times of quantitative numbers, it's hard to kind of put them into perspective, right? But consider that this would have been happening in the first few months of the COVID-19 pandemic. And what kind of serious issues were faced by a group that was disproportionately faced by COVID-19. So the fact that there's kind of this basic lack of information of what to do when facing a serious issue is concerning. When we asked individuals, so this represents a smaller subsample here when you see no translator offered, because this would only have to do with people who actually navigated the healthcare system. But you can see that the overwhelming people who actually did access the healthcare system or entered the healthcare system were not offered an independent translator. In most of those situations, employers translated for them. The majority of individuals also expected to get inferior care and felt that healthcare workers lacked awareness. And when we said lack awareness, we were asking specifically about whether they felt that clinicians understood how health influence their workplace status and their status in Canada. So a little bit of background on that. When we think of this population, it's a population that it's well documented that this population is typically dependent on their employers to access healthcare, to get basic information that they need. And this presents a real challenge for individuals who work very much with their bodies and are valued for their physical labor. So disclosing health issues can be challenging. Traditionally, this occupation has also been very male dominated. So we can imagine how disclosure of issues related to mental health or sensitive issues can be even more complex when your gatekeeper is your employer. And unfortunately, during the COVID-19 context, we saw that rather than establish kind of a more independent path for migrant agricultural workers to access healthcare, as an advocate for migrant worker through the Migrant Worker Health Expert Working Group, we saw that public health units and health authorities generally leaned further and reinforced the normality of requiring using employers as kind of that gatekeeper to access healthcare services. We also looked at issues related to safety and reporting. So we only asked, of course, the question about COVID-19 in the 2020 data. And you can see that most migrant agricultural workers lacked confidence that their employers would take any measures to protect their safety. Close to half of the workers did not expect, that did not feel like they knew their rights as a Canadian worker. And this is important also in terms of thinking about the importance of workplace compensation and sick leaves and those types of things within the COVID-19 context. So we knew, for example, of instances of individuals who, even though we knew there were on paper strict quarantine rules upon arrival for migrant agricultural workers because of the exposure that they may be faced during the travel, we did see many instances where individuals were expected to work basically upon landing in Canada. So not knowing about rights has really detrimental consequences for workers across domains of well-being, but certainly in healthcare, which is kind of documented here by one of the last points. When migrant agricultural workers were asked to what extent they felt that they knew how to initiate legal claims or reports. And we can see that in 2019, this group reported 87%, and then the following year of those that we sampled, 100%. And that is the only number that we got 100% for. But I think it speaks to the fact that when people are further marginalized, their confidence in knowing and asserting their legal rights becomes that much more difficult. Lastly, in terms of confidence in reporting legal protection. So this is important not just because of the impacts for migrant agricultural workers' legal rights, but also because of what it means for workers being able to stay safe in a very dangerous occupation and being able to assert their rights to access healthcare, for example, during a pandemic. So you can see that the main sources of support that migrant agricultural workers would be aware of, for example, such as their consulate under the SOP, where sending country officials are still responsible for certain navigational pieces. You can see that most individuals disagreed that the consulate, or many individuals disagreed that the consulate would take their concerns seriously. And most individuals and almost all individuals disagree that they have the same rights as Canadians. So, I'm going to come back to some of what I think these findings mean in terms of practice implications. But before I do that, I would like to talk to you now more about some research that we've done in the Ontario context. And this study as I mentioned before, was a partnership with the Coroner's Office of Ontario to analyze the deaths of migrant agricultural workers. And know about kind of the sample size for this population. These were the individuals that we were able to identify. We are aware that there are likely individuals who were undocumented that were not included in our sample, although we did have some individuals who were undocumented that we were able to include. So our study identified a few kind of key risk factors that related to migrant agricultural workers' deaths. The first seems straightforward: recruitment and travel as sites of vulnerability. So certainly air travel, we know, was exposed individuals to more risk, but other types of travel, such as again, that dependence on employer and the aggregate travel that happens typically for migrant agricultural workers to and from the airport through buses and shared vehicles, but also the recruitment piece. So while under certain programs, migrant agricultural workers may be recruited through government agencies, more and more we're seeing a proliferation of third-party recruitment. And through this third-party recruitment, there's arguably decreased oversight and more risks for workers to incur debt. So in the case of some of the individuals who did die during this time that we were able to analyze the factors leading up to this, they were recruited under false promises. They were told that they would be given visas that would allow them to also learn English, that would a real kind of a very kind of too good to be true kind of recruitment package. And in actuality, these individuals were not authorized to work. And because of that, they became aware of that status, and that made it harder for them to report the poor housing conditions and the exploitative conditions that they were facing. Another factor that we identified was what we refer to as substandard healthcare monitoring, quarantine, and isolation. So many of the files indicated that that oversight and that those check-ins had been delegated to employers. So kind of in a formal conversation with an employer saying, oh, I speak a little bit of Spanish, would result in that person now being the point person for monitoring. In some incidences, it appeared that the employer had worked with the worker to try to self-medicate some of their symptoms. There were also incidents where individuals were left to kind of fend for themselves in terms of navigating the healthcare system. So in one case, for example, a migrant worker became unresponsive within their hotel room, and several of their co-workers knocked on the door, didn't get a response, and their notion of what was next to do was reach out to the manager of the hotel and the manager of the employer, rather than to emergency services. And a lack of really being aware and knowing how to access those emergency services did come up in several of the files. And exacerbating these risks was the reality of overcrowded and poor housing quality, not just during the duration of the migrant agricultural workers contract, but often during the quarantine or subsequent isolation periods. Barriers to accessing healthcare, I did already mention that those delays in emergency medical response and some of the reasons behind that, a lack of interpreters, also in terms of the point of care when a person was had a critical health status. Also concerns for expenses and delay in care. So in one file, there was an individual who actually initially refused what could have been a life-saving treatment because of a concern of cost. Concern for costs is something we see that's not surprising given this population, and it is a justifiable concern at times, even though these individuals technically have access to provincial health coverage. So again, just some examples of how these individuals were further endangered because of these larger gaps. We also, because of the limitations in what was available in the file, we were also limited, we raised some more questions that we were kind of unsure of. For one, there was very limited contact tracing that we could look at in the files. There were also some questions, some concerns around eligibility for workplace compensation. And this is something we see across sectors because because our society thinks of these individuals as transient or tourist like, most frontline service providers are very unaware of what things migrant agricultural workers are eligible for. But in a few particular cases in the files, what we were concerned about was that we were seeing inspectors, particularly in the Ministry of Labor, who were deeming these files as unrelated to workplace because the individual hadn't presented to the work site. But really, these individuals were only permitted to be in Canada and were quarantined in order to begin work in agriculture. So kind of gaps in jurisdiction, or kind of assumptions of who is deemed eligible, creates ripple effects, not only for the individuals who have lost their lives, but also for their families who have to incur huge costs and huge losses. So I will mention some practice recommendations that we developed specific to this research, but I think you'll be able to tell that some of these things apply equally to some broader healthcare barriers that migrant agriculture workers might face. So for one, because these individuals face unique exposure risks because of travel, because of the housing requirements that they were typically under, we would need specific protocols to curb transmissions. And while, for better or worse, COVID-19 may be more or less on the radar depending on one's professional context, it's certainly something to keep in mind as we may see future pandemics and infection control processes generally. The need for accessible and independent. So I've emphasized independent testing, monitoring, and care provision because, again, I really want to challenge the normalizing of employers as gatekeepers and critical, discretionary people involved in the care. I can't tell you how many times I've had the opportunity to talk with clinicians about the protocols that they have in place, and key to their recruitment plan and key to their engagement plan with migrant agricultural workers is getting permission from employers to access migrant agricultural workers. This is just, it's not appropriate because it's a conflict of interest. It can create new risks for migrant agricultural workers that they're very aware of and justifiably would like to have that two-way communication. Anticipating language and financial barriers. The translation piece, I would hope it wouldn't be an issue, but for some reason, we always hear about clinicians who are using their smartphones or using their body language or are assuming that whoever a migrant agricultural worker presents with is an appropriate person to relay information to. So anticipating language barriers in a respectful and comprehensive way, as well as some of those financial barriers that can prevent timely care is important. And at a more proactive level, we need a better orientation and support for migrant agricultural workers to navigate the healthcare system. So in Ontario, this group does have access not only to private insurance coverage, but also to OHIP. But it's a moot point if these individuals don't know how to actually access and navigate the healthcare system. So a better orientation to this group to provide kind of a more meaningful opportunity for them to access these resources is important. Prioritize relationship building. So during this time, I would say that there was a lot of emphasis about how do we get information to migrant agriculture workers? How do we get resources to them? What that really negates is what clinicians and other support providers don't know about the challenges faced by migrant agricultural workers. So for example, there was a lot of food insecurity experienced during the quarantine period by this group. There were a lot of kind of really substandard compensation and payment schemes in place during the quarantine period and beyond for migrant agricultural workers if they became sick. These are things that some of us may see as outside of our scope, but if we don't address them and bring them to light, and we have to do that through conversations and taking on a learner approach with migrant agricultural workers, they will not be addressed. And the priorities that we see may not actually be the best priorities for this group. Partnerships with trusted organizations as well. This may seem a little euphemistic, but the reality is that there's the support landscape for migrant agricultural workers is changing, in part because of some promising investments by federal governments. But these support organizations are typically not considered within the circle of care by clinicians. They're kind of seen as volunteer, ad hoc, and something that is not really on the radar of the healthcare system, which further limits migrant agricultural workers' engagement with the healthcare system. So lastly, I want to talk to you about a study that has to do with migrant agricultural workers' housing. And I hope the connections are being made here, because I know I'm talking about 3 separate studies, but in actuality, I'm trying to present to you kind of a grander narrative of some of the challenges, the layered vulnerabilities faced by this group that kind of go hand in hand and are very hard to talk about in isolation. So you'll recall that I mentioned that overcrowded housing and substandard housing and isolation were key factors that contributed to migrant agricultural workers' deaths in the files that we analyzed. So one of the recommendations that we made was greater inspections of housing and for reinvestment in something that the federal government committed to years ago, which is national housing standards for this population. So we decided to do a deeper dive to better document some of the main housing challenges faced by migrant agricultural workers. And this work is still in progress, but here are kind of some of the key themes that we've been seeing so far. One is, again, that isolation that goes hand in hand with employer control. And I hope it's not coming across where the intention is not to malign employers, it's to speak to the misalignment of an employer's role and substitution for independent access to health and social care. But there are also some examples of explicit surveillance, inappropriate curfews that further segregated migrant agricultural workers and was detrimental to their mental health. This all seems very basic, but continues to be a challenge for many individuals: water, food, and sanitation, in part because of overcrowding, sometimes just really inappropriate conditions, such as housing in sheds or garages, or a facility that also housed, pesticides or so on. So we're really seeing a group that in a lot of ways is living kind of in the fringes of society, and many of the challenges that they face in housing isn't seen. With kind of the changes in climate change and the extreme weather that we see in Canada, issues of heating, cooling, and electricity took a lot of precedent. Another issue that's of growing importance to migrant agricultural workers is access to internet. So without being able to communicate with their families, which is of course a mental health stressor, but also with even less opportunities to navigate health information and the service system without access to internet is something that we're seeing. And overcrowding, which I think I've spoken to a fair amount, but also the lack of privacy that comes with it, especially when we're looking at groups that are very much gender segregated. Issues of conflict and workplace hierarchies can play out in living conditions in ways that create really poor quality of life for migrant agricultural workers. So I wanted to share just this image, which I think speaks to kind of the isolation that migrant agricultural workers are faced. This is from, I did have the opportunity to interview women in this region, and one of the things that came up was just a lack of security. So a lack of locks on doors, fear for kind of the employer's family who may express aggression. So just really basic things that we would assume people would have in their living conditions. And I also wanted to share some words that migrant agricultural workers shared. So one individual said, "Because health conditions are not appropriate, it was, I repeat, where the black water passed, it was a garage, it was dirty, there were cobwebs, dust, there was everything there, and it was very cold." Another individual said, "I believe that they should give us a dignified home, that they give us a home that has the essentials. We're not going to ask for more, but I think that they should give us heating, air conditioning." And for me, these types of accounts are really heartbreaking because our interview guide has explicitly been structured in a way to ask migrant agricultural workers, what is the ideal? What are the things that you want with your housing? What would make you feel well? And constantly we are being told we don't want a lot, but we do need the basics. Here's an image of just some, this is an image that migrant workers took of just what their outside looked like and how close kind of the garbage was to their home. Some more quotes. Sometimes we didn't have the chance to go shopping and everyone donated a little of what we had to make our food because you only went shopping on Sunday and it was the day you rested and many times you fell asleep. You were exhausted and if you didn't go that day, you had to wait until the next Sunday. Another individual said, "Well, the doors they were always open because as always, the supervisors came to check that is to do an inspection. We could never have anything, closed doors." So I think what I'm trying to illustrate by sharing some of these quotes with you is the level of surveillance and the fact that for many migrant agricultural workers, because their housing is on employer property, and because they're only authorized to be in Canada as migrant laborers, there's no separation for them of being at home and being at work. And this is really draining and takes a toll on their mental health, but also creates issues of really severe isolation because of really long work hours and dependence for transportation. There's limited opportunities to even get off site and have just a minute of recharge or even to get basic things like groceries. A few more quotes. It was psychological abuse. They offended us and emotionally we were all harmed because they made us feel less than. And even they would say, "You aren't in El Salvador," as if to say, "Your rights are worth nothing here." They called me stupid, donkey, and even spit on my feet. And another individual mentioned, and the manager came and said, "He's asleep," and left. We were watching, and it's not normal, we said. We had to speak to the manager and told him that we were not going to work until our coworker was taken to the hospital. We had to strike. So with this last quote, I've really had to condense a lot of the story behind it, but I wanted to share with you that while here, perhaps some of the quote speaks to the agency and the collectivism that the migrant workers showed in terms of head-on challenging their supervisors' lack of concern for migrant agricultural workers' health. In reality, their coworker needed to be taken by ambulance and had really severe health issues. And so often we are asking people whose role is to ensure productivity, to also somehow be responsible to monitor the health and ensure access to healthcare. And it's a really common thing that we hear is people saying that they're not getting timely medical care and they're not getting timely responses to get to healthcare access. So I really want to outline again that need for independent access to healthcare, but also in this case, how it intersects with isolation and poor housing when migrant agricultural workers are often geographically and socially segregated. So again, I'm going to outline some implications of the last study here that I've shared, but I think that it applies equally to some of the just broader concerns that we've seen. So first, we need, again, those consistent and rigorous national housing standards. We also are seeing that this group is often dependent on, or there's an expectation that these individuals will have the knowledge, the trust, and the ability to report concerns that they have. And we found that this complaint-driven process is insufficient. We need proactive and unannounced and comprehensive inspections. So we know we need federal provincial agencies to work together along with public health units to do meaningful inspections and check-ins with migrant agricultural workers about how their housing is, how their workplace is, or if they're experiencing any abuse. Another possibility would to look into more government-funded and community-oriented housing. So what does it say about our society that we are housing these individuals on the margins of society simply as a way for them to work? We can't value them for their labor and not value them as human beings. So I think this raises a moral dimension to housing concerns. Independent and safe transportation options to address so many of those access and service and social support barriers. And lastly, multi-agency regulations, because with a group where a lot of the issues raised could arguably come under federal jurisdiction, we get into that kind of interjurisdictional punting, right? Of no, this is a labor issue. No, this is a health issue. No, this is a, this is an agricultural issue. And the individuals who are really at a loss because of this are migrant agricultural workers themselves. So on that note, we need to also address the broader vulnerability that's in play for migrant agricultural workers. This group is actually, based on legal precedents, are actually limited in their ability to collectively organize and unionize. They also don't have a meaningful path for permanent residency. And a lot of research has shown that their temporary status alone will limit our ability to help these individuals assert their rights. But I think I want to kind of get into questions with everyone, but one last thought that I would have moving forward this is that given this, given the challenges that we see in terms of people taking accountability and helping to transform the system for these for this population, I hope that you see a role for yourselves in helping to bring the justice, dignity, and health that this group deserves. Thank you so much. And I have just included here, if those of you who are interested in reading more about my work, it's available open access in a few different journals. And here are the research articles that I've outlined today. Thank you so much.
Thanks so much, Dr. Caxaj. That was really interesting presentation, and certainly highlighted across a number of realms the challenges faced by this population and the power imbalances that they experience. So just let everybody know that you're welcome to put questions that you may have, and there's a question and answer box, and you can type them in there. I just have a question for you, Dr. Caxaj. You mentioned collecting survey data using verbal strategies in some cases. And I was wondering, in terms of recruitment, if you'd experienced challenges in engaging workers to participate in research, given some of the potential concerns that they might have had regarding their own personal safety or their job security if they were to share their experiences. And what were some strategies that you used to manage that in your research?
Yeah, thank you for that, Anna. It was really a huge undertaking. And I think it's one of those things where I often hear people saying, okay, well, just put a survey link online or put it on a phone or make an app. And my experience has been that kind of passive recruitment, I don't think is going to work with this population. So in our case, we were fortunate that we had research assistants who had a trusted track record of migrant agricultural workers. So they were already people who were known and were responsive. So in other words, if an issue came up for that individual, they knew that they would be referred to the appropriate people, that they would be followed up with accordingly. So that made it easier to kind of spread the word about people building trust in terms of participating in the survey. But the person who actually did the survey needed to have, right, that the face of the study needed to be somebody who was already trusted. But we found that it needed to, or our approach was also to make the survey a very, I don't want to say informal, but we needed to create kind of a more kind of warm environment. So the typical format would be like taking someone out for a coffee and doing the survey. And I find too, like, people will share if they have rapport with you, or if their stories are complex. They're not going to have these truncated responses of yes, no, or I agree, or I disagree. Like, people had a lot more that they wanted to share, that we tried to document, and we tried to make space for it, right, rather than interrupting. So it meant that the surveys were very, very time intensive and a lot of work, but it seemed to pay off in the end.
Okay, thank you. Just one more question. You mentioned at the end, that you hoped the audience members would have a role to play in supporting this population. And I was wondering, a couple of sort of take-home messages that you could give perhaps to clinicians who might deal with this population in the course of their clinical practice, some recommendations you could leave them with.
Yeah, sure. So I would say again, like, it seems so basic, but like having an independent translator, or even better, I think, is to have somebody who's already known to that individual in a support role, right? Because that means that when things come up, sometimes the problem with professional interpreters, in my view, is, I mean, it's great because they are an unbiased person who doesn't present kind of a conflict of interest for migrant workers. But the challenge is that they are not knowledgeable about the rights, entitlements, and benefits of the group. So if issues come up and clinicians aren't well versed on some of those issues, then it just kind of creates a bit of a can of worms a little bit, right? But so in addition to kind of interpreters and partnerships with kind of support organizations that are working with these groups, I would say that there are certain kind of legal entitlements that clinicians need to be aware of. So they need to know that this group, assume they come from a temporary migrant program, they are eligible for OHIP. They should have a health card. Sometimes the employers hold on to those things, right? So asking questions like that. They do have private insurance. They are entitled to workplace compensation, right? Because I'll tell you so many times, there's just this kind of box that, or like switch that switches on when clinicians sometimes see migrant agricultural workers, where they think about it like now they're practicing in like a global context and it's just like a kind of charity kind of model, but really these individuals are entitled to all those pieces. So all those things that you would do for someone you identify as clearly a Canadian permanent resident, you should be doing for an individual. If somebody shows up with an injury and they're a migrant worker, it doesn't mean that you don't have to file a workplace report. It doesn't mean that you don't have to ask if there's an injury. It doesn't mean that you have to ask about what compensations they require. So those are some things. I would say that at a more kind of program level, investing in real mechanisms to engage and have relationships with migrant agricultural workers that isn't at the whim of employers, not because all employers are these like evil doers or anything, but rather because it creates an inappropriate, it establishes a lack of trust and a lack of meaningful two-way communication.
Okay, no, that's wonderful. Thank you. Thank you very much. I see we have no more questions today. Oh, hang on, there might be one more here. Yeah, one more question. Are there easily accessed resources that that clinicians can access or keep on hand to share regarding migrant workers' rights and how they could support them?
Yeah, and I can actually just share that screen with people again. Hold on, there's in addition to kind of these two sites, migrantrights.ca, migrantworker.ca, migrantworker.ca has compiled lists of resources. Local unions that have to do with agriculture typically have some understanding of migrant workers and may be able to point you into to more kind of regionally specific resources. But I would say that it would depend a little bit on the region. And the one problem is that because these organizations are funded on such an ad hoc level, like you couldn't assume because it was available 2 years from now it is. But I would definitely say check out that website, migrantworker.ca. because the Migrant Worker Health Expert Working Group has developed resources across the country for migrant agricultural workers.
Okay, that's wonderful. Thank you. Thank you very much.
And another thing I can say along those lines, I think it's important, is that I think that we should engage consistently with local settlement organizations, because many of them are aware that this is a population that kind of fits within their radar, but they may not be as involved as they should or as they could be, or they're concerned, right? Because most money for immigrant populations comes from federal funding, which has traditionally made a caveat that it has to be a group that has a clear path for permanent residence, which would exclude migrant workers. But in the past few years, the federal government has started to allow settlement organizations to more explicitly work with these populations. And if they haven't, I think knowing that this trend is in place, settlement agencies should have this group on their radar. So I think it's worth a conversation, even if nothing is in place for them at the moment.
Okay. Oh, that's wonderful. That's very helpful, I think, for clinicians or anybody who's attending the webinar. So I want to thank you again, Dr. Caxaj, and thank you to the audience for attending this first session. And I just wanted to remind you that the Scholarship Live sessions will take place on the final Tuesday of the month, so in the lunch hour time slot from 12 to 1 p.m. So the next session will be on March 28th. And thank you again, and have a great day, everyone.
Thank you.